Melanoma is initially picked up on a skin check. Well, some patients might have a suspicion that they have something wrong. So I find a lot of the patients aren't necessarily aware of the melanomas that I end up finding. And we just find something as part of their routine skin check. And to us who have had the training, there's certain things that make something stand out maybe from the other moles or the other areas on their skin that sort of push us in the direction of thinking that something might be a melanoma, but we can't really be sure until we take a biopsy of it, which means usually removing the melanoma, or removing the suspicious thing that's suspicious for a melanoma, and sending that off to the lab, getting the results back, and once the lab's had a chance to have a look at it, then we can confirm whether it's a melanoma or not, and then we sort of decide how we need to proceed from there. Certainly melanoma, particularly at a younger age, is a significant risk factor for family members. And certainly anyone who's had a family history of any sort of melanoma at any age, we would recommend having at least a baseline skin check and then being advised by their doctor from there as to how frequently they should be having their skin checked, in addition to monitoring their skin themselves periodically. As a rule, generally melanoma needs to be cut out. The amount of area around the melanoma that needs to be removed is dependent on how aggressive the melanoma is. But there's usually some form of further surgical procedure required. If it's an early stage melanoma, that's often sufficient to remove it, and there's a very low risk of it coming back over the long term. But we keep sort of close surveillance on people because we know that they're at higher risk of having other melanomas once they've already had one melanoma. If it's a more aggressive melanoma, they might need closer surveillance in future. Occasionally, they may need to be referred to a specialist melanoma centre for further management in really aggressive cases. We aim to pick melanoma up in the very earliest stages, usually when it's just sitting in the surface of the skin before it's had a chance to spread any deeper. So if we can find it in that early stage and remove it, the prognosis is very, very good. So we're looking at a very low chance of anything coming back over a 20-year period for someone with just an early stage melanoma that's adequately removed. If unfortunately we can't get to it at that early stage, then the prognosis can go down depending on how deep and how invasive that melanoma is. The majority of the ones that we would find on people that come in for regular routine skin checks would be in the early stages, which means that much better outcomes for them over the long term.